Maybe the infant has been involved in an accident, or maybe the infant has fallen off of a bed or off of a table. You perform a primary and secondary assessment, and you notice that the infant has restricted movement in its extremities, in its arms, in its legs, or the infant cries out in pain whenever you touch an arm or a leg, or there's swelling or there's bruising. Well, you want to go to page 18 of the textbook for extremity injury. If the injury is bleeding, then we're going to want to stop that bleeding. And so we go to bleeding control, found on page 20. We want to clean that wound, found on page 26. We want to gently support the extremity. And what we want to do is we want to apply RICE, which is an acronym for rest. Rest is we want to prevent the infant from using that extremity or moving that extremity. So we might want to place a blanket or a rolled up towel around that extremity to keep the infant from moving it. We can put some ice on that too, on the bruise or on the area that's swelling, and we want to make sure that we don't put that ice bag directly against the patient's skin. Where it's ice on skin, we want to put some fabric, thin fabric in between the infant's skin and that cool pack, that ice bag. And then if it's something that we can elevate, if it's an arm or a leg, let's elevate that a little bit to take some of the pressure off of it. And then contact the doctor or call 911 if you think that this is a fracture or if you are concerned in any way about the infant.